What can every woman do, whether she's 28 or 38?
I love how you frame that, I just want to say, because so many people have a life goal of having a child, yet the approach is, I'm not ready, so I'll think about my fertility later. But if we step back and think of everything we've talked about, if inflammation is contributing to chronic health disease later and making fertility worse, the sooner you understand your body, the better. Mm-hmm. So I'm gonna go into my lifestyle tenets, but before that, I think that everybody should get their AMH checked if they do want to have a kid one day, because finding out your AMH is low gives you the opportunity to find out why, but also to think about, should I freeze my eggs? Am I with a partner? Should I consider having a child earlier? Or I've had women do nothing, but they were the one to make that decision versus having time make it for them, which is very powerful. You should learn to track your cycle. Not just when is my period coming, but when am I ovulating? Because the first stage of an abnormal ovulation is a shortened luteal phase. That's second half of the cycle. But you only know how long that is if you know when you're ovulating. Yet most women use apps. They just put in cycle day 1 into their app.
Yes.
And it's predicting an ovulatory day based on a calendar method, which is highly inaccurate and only actually predicts ovulation correctly in 21% of women.
I ovulated on day 14 last month. I know it's TMI for everyone.
I think everybody loves TMI on this.
Okay, is that bad? 14? Day
Not necessarily. How long is your total cycle?
28 days.
Okay, so day 14 is great. We really want that luteal phase to be at a minimum 12 days in length. So if you ovulate on day 14, that means your luteal phase was 13 to 14 days. So that's perfectly appropriate. When we see that luteal phase getting shorter or having a lot of spotting in it, it's a sign that the brain ovary, we're not making enough progesterone, which is largely due to probably, there's a few different reasons, but it can be an inflammatory process of the brain, some static interference. It can be from thyroid, prolactin, but it's that first sign. So actually, short luteal phase can be the first sign you might have still a regular cycle. So if somebody just says, is your period regular? You're gonna answer yes. But is it normal? It actually is not. You just don't know that.
Okay, so tracking.
So tracking. And I go over this in the book, and we're running out of time, but to think about really learning your physical clues. So this is going to be your body temperature, your cervical mucus, or hormone tracking to look for an LH surge. These are ways that you can know when you ovulate, which much more accuracy. This can also help you get pregnant faster. So this is just knowledge about our body. And then if things are wrong, if your period is irregular, if you have severe pain, if you're bleeding through your clothes, those problems should be evaluated well before you want to conceive. You always deserve an evaluation of those issues. But then when it comes to the fact of what can I do? And this is so personal to me because when I had recurrent pregnancy loss and I asked my doctor, what can I do about this? And all my testing was normal. And I was told nothing. But that's really not a true answer because there are things we do that make inflammation worse, cause insulin resistance, and contribute to infertility. First thing I think that everybody needs to do, you're gonna love this one, is they need to sleep more. We know that a third of US adults sleep less than 6 hours per night, but sleep is so important to hormonal health and to inflammation and insulin resistance. So when you sleep, that's when your body can clear up some of that inflammation. It's when your cells become more insulin sensitive, ready to respond. But also, it's very important in gonadotropin secretion. So the gonadotropins are FSH and LH. These are typically released in the early morning hours, but only if you're kind of having a normal nightly pattern. We know that increased sleep variability, so even just not having consistent sleep, can result in longer time to pregnancy. And for every hour of less sleep that you get, you're gonna have lower egg count retrieved, even in IVF. So sleep is so crucial to your inflammatory state, to your body's health, to ovulation, but also to outcomes like getting pregnant in IVF. Easier said than done, I understand, but it's also for male and female partners because sleep can be very detrimental to sperm. Longer time to get pregnant if the male partner is not sleeping enough. So again, it's a team sport here.
So those Wall Street guys are walking around with, unfit sperm.
Unfit. So sleep is the first thing. Second is gonna be thinking about stress. And we've mentioned the words insulin resistance a lot, and I know that you've covered this before, but the way I like to think about it is when you eat any food, your food's gonna be broken down into glucose, and that's the fuel for the cell. This is normal. And then when glucose is released into your bloodstream, your pancreas is gonna release a hormone called insulin. And this is a perfect dance where glucose comes out, insulin's like a salesman at the door, knocking on the door to let glucose in. Glucose goes in, levels lower in the blood, insulin goes away, process repeats next time you eat. However, when you have higher glucose level, either because you're eating more, the foods that you're eating, the permeability of your gut, or even chronic stress, because stress does something to free up glucose. What starts to happen is that your cells become insulin resistant. And it's like if a salesman came to your door every single day. What are you going to do? You're going to stop answering. You don't want to talk to him. That's what your cells do when they see insulin so frequently. And then it takes a really high signal of insulin to get the door open. That salesman has to bang on the door. When this happens, insulin starts to level up in your blood. This causes you to deposit more visceral fat, which is highly inflammatory, and then interferes directly with the hypothalamus and hormone secretion, in addition to ovarian hormone production. So hugely detrimental. The worst thing about this is that your cell doesn't have glucose in it. So you're actually cellularly starved, but there's so much glucose in your bloodstream that your liver says, we need more glucose, and starts to break down the glucose it has stored from a process called gluconeogenesis, and puts more glucose in your blood. So now you have even more. And you can see how this is a cycle that's causing so much inflammation. Well, when you are stressed, let's think about what stress does, because our bodies were meant to deal with acute stress. If you saw a bear, what do you want to do? You want to run. So in order to run from the bear, your body would free up some more glucose to get into your bloodstream, so it could fuel your heart, your lungs, your muscles to get away from the bear. So you'd have glucose released, you would run and use up that glucose, and then you'd go back to normal. But bears aren't what cause us to be stressed in today's world. It's an email, a bad meeting, a bad doctor's appointment,
notifications,
all the things on our to-do list, social media. It's 100 things. So we're constantly undergoing this process, and then we double down. We eat, we stress eat, we stress drink, we add to the glucose burden that is inside our body. Our cortisol is constantly activated. It's going to make it harder to sleep at night. It's going to really wreak havoc, and this is why cortisol is inflammatory. So long story short here is that the world is stressful. For me to sit here and say, Louisa, you should be less stressed is very...
Breathe, breath work.
But I do think that means we should carve into our day. I have two different approaches. One is going to say carve in 20 minutes that you do allow your body time to let cortisol go down. And not just in response to something stressful, but more preventively. And you and I are wired differently. So it might be yoga, meditation, acupuncture, walking outside, feet in the grass, talking to friends, seeing a therapist, journaling. It doesn't really matter. It's just, we all know when we get that feeling, and that's what we are searching and striving for. The other is going to be, I recommend when you have a stressful life event, run from the bear. Meaning you get out of a meeting, it's really, really terrible. Go walk the stairs, do a couple squats, do something to use up that glucose. And the reason why is that in our muscle, we have a transporter called GLUT4 that essentially is like giving glucose the key to the cell. I don't need insulin anymore. I don't need the salesman. So I can allow glucose into those muscle cells by building and using skeletal muscle. So when I'm stressed, go use some muscle. But also that means the best exercise for hormone health and for fertility is to build more muscle and then use that muscle. Strength and resistance training at least 3 times a week is the key to really help combat insulin resistance. And it's something that so many women, at least we see more people talking about it now, but I still see a large portion of younger women who are not doing any strength or resistance training. They're still very cardio focused and still chasing a certain body type, size, or aesthetic. Yet these things, sleep, stress, and exercise, are really foundational principles for your day.